with America Walks. As a British immigrant to the United States, I continually strive to deepen my personal understanding of the indigenous history of these lands. And I want to honor the past, present, and future generations and recognize the sovereignty of all of these tribal nations. Our guest speakers today are Sherry Bozick, Director of Planning, Development, and Transportation with Pueblo of Jemez. Pollyanna Kugatrax Dakota Littlebull may not be able to join us today, although she was scheduled to be a panelist because she's fighting wildfires on the Yakima Nation. Maya Pedersen, Assistant Professor with the School of Public and Community Health Sciences at the University of Montana, and Hillary Mead, Primary Prevention Program Supervisor with Cherokee Nation Public Health. As always, we're very grateful to our sponsors, the U.S. Centers for Disease Control and Prevention and their Active People Healthy Nation campaign, EcoCounter, and Tool Design. And you can support America Walks webinars and other programs if you wish. There's a link to our donations page in the chat stream of the Zoom interface. If you have a question for the panelists, please enter it into the Q&A section. And this is also where you can find the closed captioning feature. These are today's webinar objectives. After attending this webinar, participants will be able to discuss the reasons tribal communities experience disproportionately high rates of pedestrian fatalities, describe how temporary quick-build projects can be used to reduce traffic speeds and improve safety in the short and long term, and explain why it is important to practice authentic community engagement and give examples of effective strategies. Here are the latest data on pedestrian fatalities in the United States from Smart Growth America's most recent edition of Dangerous by Design. In 2022, more than 7,500 pedestrians, that's about 20 every day, lost their lives on America's roadways. This number has increased steadily for more than a decade and is now 75% higher than it was in 2010. It's important to recognize that these tragedies, like so many other social harms, have a disproportionate impact on communities of color. African Americans are more than twice as likely as white people to be killed by a motor vehicle while walking, and Native Americans are more than 4 times as likely. Speed is a critical factor in whether or not a collision is fatal. According to the AAA Foundation for Traffic Safety, the likelihood that a pedestrian hit by a car at 20 miles an hour will be killed is less than 10%. However, this rises to about 20% at 30 miles an hour, 50% at 40 miles an hour, 75% at 50 miles an hour, and 90% at 60 miles an hour. Clearly, if we want to minimize fatalities, we need to keep speeds below 30 miles an hour, preferably below 20 miles an hour in areas where people are walking. Unfortunately, this is not the case in most tribal reservations in rural parts of the country, where vehicles travel at high speeds and there are usually no sidewalks. Nor is it true in the urban and suburban areas of many cities where Native Americans reside and have to contend with excessively wide roads and no pedestrian crossings. This is New Mexico State Road 4 in Pueblo of Jemez, dead straight with long sight lines and no visual friction at the edge of the road and no pedestrian infrastructure in this photograph. However, I want to note that pedestrian safety and comfort are improving here, as you will hear shortly from Sherry. At America Walks, we've been working with Sherry and other tribal partners on this issue for many years. In 2022, we hosted a policy roundtable on tribal pedestrian safety, focused on the following problem statement. Tribal communities are often bisected by county, state, or interstate highways with high-speed vehicles, which create safety, health, and quality of life problems for residents. That policy roundtable and many other programs for America Walks was funded by the U.S. Centers for Disease Control and Prevention. And I'd like to welcome Christina Dahlstrom, a senior policy advisor with the Physical Activity and Health Branch of the CDC, to make a few opening remarks.
Thank you so much, Ian. Really appreciate the opportunity to join you all today. As Ian said, my name is Christina Dahlstrom, and I help manage an initiative called Active People, Healthy Nation. Our goal is to get 27 million Americans more physically active by 2027. And today I just want to share a little bit about the work that we are doing at CDC and acknowledge that you all and the work that you're doing in the field are really the leaders in this space. So thank you for all of your work. At CDC, we are focused on creating opportunities for people to walk, bike, and take transit, what we call activity-friendly routes, to everyday destinations they go to, such as workplaces, schools, parks, healthcare. Unfortunately, we know that many people do not have access to safe places to walk, and they do not have places they can go to conveniently in their communities. We also know, and Ian already shared a little bit about this, that there are racial and ethnic disparities in pedestrian fatalities and injuries. And I just want to highlight again the data that is so critical in driving this work is that we know from the Dangerous by Design report that just came out from Smart Growth America that American Indians and Alaska Natives are killed at 4 times the rate of white people when walking in their communities. And so this is just why this work is so important. And I want to make sure that you all are aware of some historic federal funding that's currently available to support this work that is happening in terms of being able to create activity-friendly routes to everyday destinations. So there are 2 current funding opportunities I just want to draw your attention to. One is these are both through the U.S. Department of Transportation. One is the Safe Streets and Roads for All program. And the other one is the Reconnecting Communities program. And tribal communities are eligible for both of these. So I encourage you to check out the links in the chat that you'll be able to see here soon. And finally, I just want to acknowledge and thank the amazing partnership with America Walks. We were just so honored to support the policy roundtable and the report that came out of the tribal pedestrian safety work that Ian mentioned that we're talking about today in 2022 that helped kind of jumpstart a lot of this work and really helped to leverage the funding from the National Safety Council for the work that you're going to hear about today on responding to tribal pedestrian safety. So thank you again, and I really appreciate the opportunity to join you and look forward to hearing more from you.
Thank you very much indeed, Christina. And as you referenced there, I'm very pleased to announce that our partnership, which consists of Pueblo of Jemez, Cherokee Nation, Yakima Nation, and the University of Montana, has recently received a Road to Zero grant from the National Safety Council to continue this work. And it's my pleasure now to introduce Mark Chung, Executive Vice President for Roadway Practice with the NSC, to tell us more.
Thanks, Ian. Great to be with all of you here today, this afternoon. Ian set up this conversation with data and some grim data. And at the National Safety Council, we're no different in that we follow the data, we track the data to direct the efforts that we need to undertake to address what we're seeing on the roadways. And what we're seeing is that just to underscore what Christina has already mentioned, as well as Ian, that there's proven disparities in roadway fatalities and injuries, especially among those in underserved communities. So our vision is that through the grant program administered through the Road to Zero Coalition, we'll be able to apply the latest and the greatest and the most progressive thinking around roadway safety best practices to adopt the safe system approach and put into practice the safe system approach philosophy into the quick builds and the improvements that we can make into a community. Not only to produce safer outcomes, but perhaps more importantly, empower and mobilize local residents to want and to demand change, and a change for safer outcomes for everyone in the community. So this is, I think, that type of vision is what truly excites me and others within the Road to Zero Coalition, because I think the learnings that we get from planning and implementing the very safety measures through these projects and through the Road to Zero grant programs, we're going to be able to scale that. We're going to be able to share the learnings with other communities and other practitioners so that they may benefit from the work that you're pursuing. So unfortunately, I won't be able to stick around to the end of this particular webinar, but I just want to wish everyone the best of luck in pursuing this particular project. I truly look forward to the periodic check-ins on this particular project. So with that, I hand it back to Ian.
Thank you so much, Mark and Christina. We really appreciate your support for this work. Well, I'd like to move now to our first guest panelist and invite Sherry Bozick with Pueblo of Jemez to make your opening presentation.
Great. Good afternoon, everyone. Thank you so much for joining us for this webinar. Let me just get my presentation pulled up. Okay. So I'm just going to briefly go over a little bit about what we're doing in the Pueblo of Jemez to address pedestrian safety. So for those who have not been to New Mexico and aren't familiar with the Pueblo of Jemez, we're located between Santa Fe and Albuquerque. We have about 3,900 people living on the Pueblo proper, which is the middle parcel that you can see on this map. We have 3 major land parcels, non-contiguous land, but the bulk of the population is in the one in the center of this map. The Pueblo for thousands of years has always been very much in running and traditional and cultural activities that involve walking and active transportation, not related to vehicles. And so all the changes of the modern world have had a huge impact for sure. One of the major impacts that the Pueblo of Jemez has seen is the construction of the New Mexico 4 highway, which bisects the main part of their land here and is shown in the blue line. It goes through the heart of the village. And we just completed a pedestrian trail along this highway called the Hemish Path to Wellness. So to obtain funding for this trail project, we told the story of how it came to be. We looked at historical documents and data and applied for funding. And so the total project cost was a little over $7 million. The trail goes adjacent to the entire highway, and we used our crash data and speed data and information such as that to describe the need for the pedestrian trail to increase pedestrian safety. We are proud to say we just finished construction of the Hemish Path to Wellness, and I am showing you some before and after photos of our trail project. In the middle there is a culvert crossing as part of the Highway 4, where tribal members and visitors, whoever was walking in this area, would have to walk down into an arroyo or either right on the shoulder of the highway or within the highway on the white line, as you can see in the right-hand photo. And so on the left, I'm showing a pedestrian bridge that was installed on this portion of the trail. Here are other before and after photos. On the left photo, you can see some students after school walking along the edge of the highway. And then on the right shows the construction of our new trail, which offers a dedicated pathway along the highway, a paved pathway. And just some more photos of our finished product. The community is very excited to have a safe area to walk now along the highway. We have a couple of crosswalks with lighting and then bridges to cross through those ephemeral streams. We also have other pedestrian and bicycle safety issues at the Pueblo of Jemez, which we're addressing with various different projects. Another one we just finished was a quick build project on Day School Road. This road is very wide and has no pedestrian facilities and is located in front of one of the Pueblo schools, which teaches kindergarten through 6th grade. So we convened the students to participate in this project, which was amazing and really gave the community a chance to participate and really own the project. And so we constructed a pedestrian walkway, and then we put 2 chicanes along the road to narrow the road in the area that passes by the school so that drivers would slow down in this area. And we have seen speeds decline as a result, which is great. We were seeing speeds of double or triple the speed limit, and now we're mostly seeing vehicles following the actual 10-mile-per-hour speed limit. So it was a wonderful project. And we had all of the students at the Jemez Day School participate by painting the traffic control devices and planting plants in the planters. And the project is still up now. And it was a very rewarding and engaging project, all the while increasing safety. Our next project that we are going to propose and hopefully work with the New Mexico DOT on this is to do a quick build project along the Highway 4 in an area known as the Red Rocks area, which in these photos you can see is an area where is highly concentrated with visitors, especially during tourist season. And there are no pedestrian facilities along this area. And the speed limit is 50 miles per hour, but we often see speeds far greater than that. So as part of our Road to Zero grant, we'll be working with our team, which Ian announced, and we'll be having a quick build project here at this specific location, pending approval and collaboration with the NMDOT. We really look forward to addressing the Pueblo's concerns in this highly trafficked area, pedestrian traffic area. And just a quick couple more initiatives that the Pueblo of Jemez has taken to reduce vehicle speeds and increase the safety for pedestrians and bicyclists. We've installed radar speed feedback signs with more to come. These really do work. I think they project someone's speed just as they're about to pass a sign, and we do see traffic slow down when they start flashing. So we really like utilizing these. We have also installed gateway monuments at either end of the Pueblo, which are meant to really notify the vehicles traveling through the Pueblo that they are entering a rural community. They turned out very beautifully, and we're very proud of these. So I think we're holding questions to the end. Thank you for listening to my brief presentation about our initiatives, and I am going to pass it on to Hillary Mead with Cherokee Nation.
Hillary, I think you're muted at the moment.
Okay. Can you hear me now?
Yes.
Okay, sorry about that. I've had some technical difficulties, so I think I'm back up and going. So thank you, Sherry. I appreciate that. And like she said, I'm with Cherokee Nation, and what I work on, I'm a supervisor with the public health department here at Cherokee Nation. And my main focus has been safe routes to school projects. And so, yeah. There we go. Okay, so just a little bit about Cherokee Nation. We're located in the northeast corner of Oklahoma. Our total population is 464,000 citizens, and then living just within the Cherokee Nation reservation, we have about 140,798 of those citizens. A lot of our citizens do live at large, with 282,394 at large, and our tribal lands cover 72,923 acres spanning across 14 counties in that northeast corner of Oklahoma. We work a lot with our Department of Transportation, and so they work in coordination with the Department of Oklahoma Department of Transportation and the Federal Highway Administration. So they were able to pull some numbers for me on the fatalities that do happen within our reservation. We have about 55 fatalities in the last 5 years, with 260 injuries and 35 resulting in some sort of property damage. Right now, we are working towards improving our pedestrian safety within Cherokee Nation with our Department of Transportation obtaining the planning grant for the Safe Streets for All. So that has just started, and we are looking forward to those projects that are coming out of that. So we will take a look at some of our streets, and we do have some urban areas, but a lot of our communities are located in rural areas. And so if you'll see on the left there, this is one of our streets where our school is located. We have a K-8 school. And this street is already a little bit too narrow. We have a lot of cattle trucks coming through here, a lot of big trucks with hay, things like that. And it does make it difficult already for buses to travel down this road. And as you can see, there is little to no shoulder there. And then this highway is an actual 65-mile-per-hour highway. And then if you go a little bit farther down that road, you'll see that it comes onto the school. And it is a curvy road. It's not high visibility. Back in the back, you can kind of see a blue Jeep truck back there. And that's where parents are parking and walking their kids across the street. Here's another community that we have. We have one county where a railroad actually bisects the entire county. And so, in particular, this school is located on one side of the railroad tracks, and we have housing on the other side. And so these kids are just got out of school and are walking across that railroad track. Another look at a community. We do have a small convenient grocery store in this community. And as you can see, there's still very minor shoulder there for our pedestrians to walk to. And on the right-hand side, this is the same community. We just built a community center. And if you can see, there is this Kenwood School here. And then up here is our new community center. This is about a quarter-mile distance, and we don't have any way for students to get there safely. So this is an area that we're looking at addressing, and how can we safely get those kids from the school to the community center. And currently they are being bused there. This is a recent project that we worked on. This is next to a high school, and they use the field across the street to use as a practice field for their band and their football students. And so we came in and we put in new crosswalks to at least give them some sort of visibility to walk across that street safely. that project grew, and we were able to purchase some signage for them. Like Sherry said about the flashing speed limit sign, these are flashing pedestrian signs, and they were installed down this road. And here's some pictures of those signage from some before and after. This street was not a school zone originally. And so one of the things that we did is we took this to city council and addressed it there and let them know. And the city council unanimously decided to make this a school zone. So looking ahead, some things that we were looking at with this Road to Zero grant is building a resource library. And some of the things that we have experienced is that not all of the resources match our tribal communities. And so what we're looking at is to look at what's going to be beneficial for our tribal communities. Are these sample policies or procedures, assessments, some kind of a quick build guidebook, and walkability assessments would be another one. And I've used walkability assessments several times, and sometimes they just don't quite fit the need of what's in our community. Also, within that resource library, this is something that we have been working on, is doing a walkability and observation assessment. And so this is where we walked ourselves and found out that there's no speed limit signs, pedestrian crossing signs, school zone signs, or crosswalks. And so what we did was we also did some radar checks, and this was a form that we had created just to stand out there and radar these traffic that was going through. We did find out the average speed was about 26.4 miles per hour, but the top speeds were maxing out about 40 miles per hour. And then we also, during a 35-minute time frame, we saw 26 pedestrians crossing the street. So another resource might be a how-to guide on going about presenting our findings to a city council or a tribal council, and what that might look like and how we might go about that. This is what maybe a resource guidebook might look like on how to set up a community meeting to gather that community feedback and find out what's going on, what's your concerns in that community. And then these are possible quick build opportunities. So this is that same school we looked at earlier. The county came in and put a speed bump in, and there was no signage, no high visibility around that speed bump, and it wasn't close. It was still a distance away from the school. In this middle photo, there was a faded crosswalk, and we found out that kids weren't using that, so we put in a new crosswalk here. But what would that look like if we looked at this photo on the right, where it has a speed table and high visibility points? Other quick build opportunities. This is another street that is a very wide street. It does have some sidewalks on it, but as you can see, there's no lane striping on the street. So what could we look at was doing some curb extensions, adding some crosswalks, striping down the middle, even maybe adding a bike lane there. And here's some other opportunities that we've used for quick build projects, where we've involved our youth and coming out and painting new drop zones and new crosswalks. Other things that we are looking at is offering a community workshop and finding out what our issues are in our communities and how we can go about fixing that, whether that's going through and finding those through a sidewalk and bringing those ideas back to the table. Definitely once we involve our youth, they are very good. They will tell you exactly what's going on in the community and how safe they feel walking down those streets. And with that, I will end, and I will hand it over to Hollyanna Biddable with the Yakima Nation.
Actually, Hillary, I'm afraid that Hollyanna is not going to be able to be here because of the wildfires in her community. So we'll pass on to Maya Pedersen with University of Montana.
Okay, thank you.
Thank you, Hillary, and thank you, Ian. Let's see, I'm gonna share my screen here. How's that? Can I get a thumbs up? Is it there? Okay, thanks. Hello, everyone. Good morning and afternoon, depending on where you are. My name is Maya Pedersen. I am a research assistant professor at the University of Montana in the School of Public and Community Health Sciences. And I have a co-lead on the project that I'll be talking about today. Her name is Dr. Samantha Morajo. She's a physical therapist at the Confederated Salish and Kootenai Tribes Tribal Health Department. Samantha is not presenting today, but she's here in the crowd, keeping me in line. So today I'm going to be sharing a little bit about an ongoing initiative that is a partnership between the University of Montana and the Confederated Salish and Kootenai Tribes Tribal Health Department to promote physical activity among older adults living on the Flathead Reservation in Montana. And this presentation is called Crowdsourcing Tribal Walkability Data with the Our Voice Method. So first I'll just start us off with kind of orienting where the Confederated Salish and Kootenai Tribes lands are on the Flathead Reservation. This is in western Montana. The CSKT, or the Confederated Salish and Kootenai Tribes, reside in about 1.3 million acres of the Flathead Reservation. On this reservation, there are approximately 31,000 residents, and approximately 8,000 of those are Native American as their primary ethnic and racial identity. Another kind of key interesting point about the demography of the Flathead Reservation that relates to this project is that about 22% of individuals living on the reservation are ages 65 and older, which is higher than the national average of 17%. So you hear that we're talking about older adults and focusing on access for that population, given that it is a higher population in this area. Just kind of bringing it back, we've already heard, data across the different presentations about fatalities and injuries. This is data from a 2020 Montana crash study that was completed. And as the Montana DOT, or the Montana Crash Initiative, is working to decrease fatal and serious injuries in Montana, we see this comparison of these first 5 years of implementation of practices versus most recent 5 years. And what I'd like to bring your attention to here is that at the very bottom, you see one of their focus areas is Native American fatalities. And we see here that as a comparison from the first 5 years to the second, this is the only data source where the numbers have increased in the most recent years. So we see that this is a continuing issue in the state of Montana as well, with fatal and serious injuries and fatalities among Native Americans. I would say we come to this work not as transportation folks. Dr. Morajo and I are both public health researchers and practitioners. And so our main area of kind of project foundation has been this Growing Older, Staying Strong project. And that's the lens through which we have come into this pedestrian safety issue and sphere. So the Growing Older, Staying Strong initiative is a community-based participatory research project, as I mentioned, between the University of Montana and CSKT. And our goal is actually to improve physical activity security among older adults. And physical activity security is specifically when all people have physical and economic access to sufficient, safe, and enjoyable physical activity to meet not only their health needs, but to promote physical and emotional well-being and social connectedness for an active and healthy life. And so what we see within this definition is safe physical activity. And what we found through some of our early work doing community-based participatory research is that safety is a major issue for older adults in participating in physical activity. So what is community-based participatory research and why are we using it within this project? Essentially, this is this collection of principles to really center on voices of community members for community-driven, action-focused research and change. And I won't read each of these, but I will highlight a couple of the principles. One is this really important component of building on strengths and resources of a community. So thinking about what's there already and what can we build on as assets while we're addressing challenges. Another I'll say is this collaborative partnerships at all stages of research. And this partnership that is the Growing Older, Staying Strong project has been going on for about 6 years. And so it's taken us about 6 years to get to this point where we've done an iterative process of learning about physical activity influences and factors and identifying various areas where we can support to promote change in physical activity security. And one of those I'll mention is a study we did back in 2020 where we did a series of qualitative interviews with Native American older adults living on the Flathead Reservation. And we were really trying to find both the facilitators, or what helped them be physically active. And in this study specifically, we were asking about walking, and then also barriers, what's getting in the way of walking. And we categorized our qualitative data by individual, social, and environmental levels. And what we found really in terms of facilitators were some factors that really related to the safety of pedestrians and to the value of walking outside and having spaces to walk outside. So one of those was this personal connection to land, the value of wanting to be outside and moving. Another was multi-generational physical activity, wanting to be able to walk with family and kids, grandchildren outside, having safe spaces to do so. Another was leveraging this existing paths and trails in the community. So those were considered facilitators. We also see in terms of barriers where this lack of acceptable walking areas for engaging in some of those kind of positive motivators. Safety was a major issue, as well as investment by leadership and development of opportunities to be active outside. And then we see historical changes in policies that have created conditions that are unsafe for walking and moving around outside. So drawing on these data, drawing from the voices of Native American older adults living on the reservation, we really come to this project that we'll be talking about today, which is using the Our Voice method, and I'll introduce the Our Voice method next, to crowdsource information on pedestrian safety and walkability from the perspectives of Native American older adults living on the Flathead Reservation, and subsequently to develop community-driven solutions to improve pedestrian safety for CSKT older adults and community members. So the Our Voice method is described as citizen science for health equity. And this method was developed by Dr. Abby King at Stanford University and continues to be the platform for Our Voice, and the collaborators for Our Voice are still housed at Stanford University. So we'll be partnering with the Our Voice shop there to do this work. And the Our Voice tool, I'll just give you kind of a brief overview here, and we'll get into it in the next few slides. But the Our Voice method starts with this discovery tool. These 3 shots here are screenshots of a phone or a mobile device of some type using this mobile app to collect data by community members. And this is anonymized data that can be collected by community members. And the output, there are a series of different ways to see the output, but one of them is this series of pictures that an individual may have collected, as well as a geotagged link for each of the photos, and also the specific walk and route that they went on. This way, the data can be very standardized, can be looked across, within a specific community area or residential area, and also can provide that macro level data in terms of looking at hotspots potentially of positive, or those green markers, or negative, or those red markers, looking down at this kind of bottom photo, while also providing opportunities for micro data. So we look at these photos and we can see the specific viewpoint of the lived experience of the individual taking this photo. And alongside those photos, you can see the kind of green smiley face or red frowny face. Individuals can rank either good or bad for those photos. And then they can add a quote. So they can add a text, or they could add an audio sharing why they took that picture, that photo, and how it's impacted them, depending on the question that we're asking. So typically this project, or this Our Voice method, is used around a specific theme. And in our work, we're going to be using it around pedestrian safety. So the Our Voice method actually encompasses 4 steps. The first step being what I just described, using this mobile app to take photos. The second being discuss, where community members or participants come together and discuss their findings. They look at photos, they read the narratives, they look at the maps, and collaboratively identify themes and areas for positive change. And then steps 3 and 4 are really this kind of process of moving from discovery to activation and advocacy. So it's where groups come together based on those themes, typically those who have collected the data, and work together to bring information, data-driven information, to policymakers or to leaders for positive change. And so this is just an example of what a potential guiding question might be within the app that we'll use, the discovery tool. Something like, what makes it easy or hard to walk around in your community, or something similar. And we'll be using a community-based process to really get at what that question will be, to make sure we're asking it the right way. And then this is just kind of a closer up, so you can see what the actual app interface looks like when you take a photo. You would take the photo and then say, describe why you took the photo, be able to rank why it's good or bad for the community. And what's cool about this app and this, the discovery tool process, is that Wi-Fi service is only needed for data upload. So individuals can walk around in more remote areas, which is true for the Flathead Reservation, and then be able to upload the data when they get back to a Wi-Fi hotspot. So just to kind of finalize, thinking about the output, by crowdsourcing this information, working with Native American older adults on the Flathead Reservation, we'll be able to collect geotag photos, narratives, and rankings, a list of community prioritized issues, specifically in the realm of pedestrian safety, and also gather a group of engaged community members who are older adults and their families to move forward with those community prioritized issues into action. I'll just end by acknowledging this awesome team that I work with CSKT, Tribal Health, as well as the Research Review Board, and our community advisory board as well, and a few others. And I'll stop here. I know I'm right at 10 minutes, but I just want to mention that this community engaged process, I think, has the potential to really bring us towards positive change for promoting pedestrian safety among older adults living on the Flathead Reservation. Although I'm in a totally different discipline than Sherry and Hillary, we haven't engaged in these like traffic or these specific quick builds or traffic changes. As a physical activity researcher and public health practitioner, we're really excited to be entering into this realm as a way to support public health from the environmental standpoint. So thank you so much, and look forward to hearing the questions.
Thanks so much, Maya, and all our presenters. I also want to thank my colleagues, Ruth Rosas and Rachel Kotner, who are running the technology and the communications behind the scenes, and just ask if you could pin everybody's Zoom window so that we can all be visible for the panel discussion, which is coming up right now. So we've received a few questions from the audience. Thanks very much for those. I'm going to integrate those into the panel questions. And I want to stay with community engagement as a topic to start with and ask you, first of all, Hillary, what kind of community engagement activities have you led in Cherokee Nation around the issue of pedestrian safety and safe routes to school? And what are your thoughts about this Our Voice technique that Maya's just been telling us about?
Hi, Ian, thanks for the question. Some of our community engagement, as I mentioned during my presentation, was the site walks and observation checks. We've used our school and their youth to go out and take these site walks. They have been able to tell us things that are in their communities that they don't feel safe walking in certain areas, where whether that might be a scary dog, or the weeds are growing in a certain place, or just they don't feel safe there. Things that at our viewpoint, sometimes we do not see those issues. And so we've been able to do that. We've also held our community workshops where we have gone on these site walks and kind of how Maya described, is taking those pictures, and we brought those to the table, and we ask people what they thought about those certain areas, and to do wish walls and think about what they want to see in the future and how they would feel more safe walking in their community.
Great, thanks very much, Hillary. Same question for you, Sherry. Existing community engagement strategy and maybe thoughts about incorporating some new methods.
Yes. So at the Pueblo of Jemez, we hold community meetings and we do a lot of outreach, to try to get as much participation as possible. We use various methods, email, invitations. We actually go to door with flyers for people that aren't connected electronically. And then word of mouth is always huge. We do incentives to draw public participation. We also ask people to come to our community meetings after work during dinner time. So we cater our community meetings to get people to come, because we are asking them to come between 6 and 8 o'clock at night. So that's the way that we would get a lot of input. We also do surveys online. We disseminate information via community boards around the Pueblo. And we are very interested in the app, though. I actually have the app on my phone. I've played around with it a little bit. I think it's really empowering for every individual to be able to go around and take photos and document where they're walking in their own community. So that might be something that we can roll out, because we are kicking off a major safety campaign at the Pueblo of Jemez. That's something that maybe we could use here to document all the spots. We also use interactive mapping, where people can log in and pin their problem areas on a map, so that we can focus in on those for our plans and design projects.
Great. Any further thoughts, Maya, having heard Hillary and Sherry talk about the community engagement piece?
Just that it's really neat to hear about all the variety of methods. And I think just one point to highlight is that it does take multiple methods. So I was talking about the Our Voice method today, but just kind of reminding that it's built on these 6 years of community-based work that we've also been doing, collecting qualitative data and other forms. And so just really inspired by hearing Hillary and Sherry's variety of forms and ways of getting community engaged input, to make sure that although the projects might be data-driven, they're also very tethered to the community voices and the lived experiences. So excited to be working with this crew.
Wonderful. Sherry, in your presentation, I noticed you were talking about New Mexico State Road 4, which goes through your community, that it was built through the community in 1942 through a condemnation process. I'd love to hear a little bit more about the history of that process, and leading to the modern day. What are some of the intergovernmental jurisdictional challenges that you're facing? And specifically, weaving in a question from the audience, do you know any examples of tribal governments gaining authority over federal, state, or county roadways, so that the tribal government can control and the operations on those roadways?
Sure. Thank you for that 3-part multi-question.
Sorry.
It's okay. I've talked about it a lot, so I can answer it very easily. So the Pueblo of Jemez, myself and some of our staff, we dug through hundreds and hundreds of historical documents from the early 1930s all the way through the 1960s. And we discovered that the right-of-way for the highway that goes through the Pueblo is only pavement to pavement edge, meaning there isn't any other right-of-way like shoulders or anything. So we were looking at that because we needed to establish right-of-way for our new trail, and we didn't know if it was in tribal land and trust or if it was a state highway easement. So we read all these old documents and discovered that yes, the 74 acres was taken by a court-ordered land condemnation because the Pueblo of Jemez tribal leaders were not approving the giving up the 74 acres, and I think they weren't moving quick enough and they needed more information. And so there was, the powers that be at that time really wanted to just steamroll ahead and get this highway built, and they were tired of waiting and deliberating with tribal leadership. And so to me, it seemed like, in reading the progression of documents between lawyers and courts and things back and forth, it seemed like they just said, we'll just use the courts to move forward. The Pueblo was compensated a little over $3,000, and that was part of the story that we told to get the funding to build our trail. And luckily, the state of New Mexico was really wonderful to work with. They heard the story. They also felt like, I think that especially the planning division at NMDOT really felt like it was an equity issue for the Pueblo. To move forward beyond the trail, we are seeking, the Pueblo of Jemez is seeking funding along with the state of New Mexico to build a bypass around the Pueblo to the east. And then in that case, the Pueblo would take over this highway that bisects their land. It's quite a large ticket for this project. We're looking for about 75 million. We've applied for the RAISE grant 4 or 5 times, 5 or 6 times over the years, over a span of over a decade, and we haven't won yet. We are really hopeful that we can construct this bypass around the Pueblo, and then we won't have jurisdictional issues. But right now, yes, if we want to do a quick build project at Red Rocks, we do need to collaborate with the state as the owner. I think NMDOT will be supportive of our project, the forthcoming project as part of this grant. I think they understand that having a highly concentrated area such as Red Rocks, which is right outside my window of my office, with a gas station, a visitor center, and vendors selling food across the street. Our tribal members sell their food and art at multiple booths across the highway, that having a highway 50 miles per hour when people are going 60 and 70 plus in an area where there are a lot of people walking around is problematic. And we are conducting an RSA to hopefully slow the speeds down and install some permanent pedestrian features. But in the meantime, we hope to carry out our quick build project with our team here at this gathered here today. So there are jurisdictional issues when highways or state-owned roads go through tribal lands. The tribes they can't make their own decisions regarding signage or speed limits or anything. They do have to collaborate, and the way to do that is to conduct an RSA, basically. You can't just make the decision, and you have to back it up with data.
And an RSA is a road safety audit, right?
Yes.
Formal process to assess the safety of a roadway.
Yes.
Thank you. I do want to just mention there are lots of questions coming in now. We're not going to have time to address them all verbally. So panelists, if you see a question and you have a response, go ahead and just type it in so that the audience receives some feedback. Maya, I'd love to just go to you next on this jurisdictional question. Is this something that you've encountered on Flathead Reservation or with the Confederated Salish and Kootenai tribes?
As a behavioral scientist, I have a lot to learn about transportation rules and policies, especially within this realm. But what I can say from some of the early work that we've done is learning about Highway 93, which is a north to south highway that runs right through the middle of the Flathead Reservation, with speed limits, I think up to 70 miles per hour. And this goes through school zones, as well as bisecting an area that connects a community center to a health center, for example. And so this is from my perspective, my limited perspective, this is an area where we will likely learn some important information and potentially some positive ways that we can work around or make modifications to improve transportation across the Highway 93. And I would just like to mention that I'm sure there are many other issues that exist on the Flathead Reservation that I have yet to learn about, and I look forward to working alongside the transportation officials as well as the CSKT tribal leadership to identify those issues, kind of as they relate to some of these data-driven themes that we come up with through the Our Voice project.
Right, thanks, Maya. Hillary, jurisdictional challenges in Cherokee Nation?
So a lot of the things that I work on are more local specific. So I'm doing a lot of city governments. And so that's kind of been where my main focus has been, and working with that city government to see if they have possibilities to work with their street department, and doing, like I said, the walkability assessments there, and looking at most of their issues that they're happening in their city streets or around their schools. And that's been my biggest part on that.
Great, thank you. Moving on to another audience question. We mentioned earlier that a lot of Native American people live in urban and suburban parts of cities. I'll just open this up. I know really all three of you are working in fairly rural areas, but from your general knowledge, working within the tribal government system, what is your understanding about pedestrian safety issues in those urban and suburban areas?
I'm going to defer to Sherry or Hillary as I have worked primarily in very rural and remote areas.
I can speak a little bit about that. I also work Pueblo Famous as rural, and so have the other tribes that I've worked for in New Mexico. Here in New Mexico, we have one of the highest pedestrian fatality rates. I think we're neck and neck with Arizona back and forth over the years. And what I've observed, my homeland is Seattle, Washington, but I've been here for over 10 years, and it's very dark, and there are no, or not none, but there are very few pedestrian facilities. We have a ton of people walking along the shoulders of highways, arterials, side streets, residential, and we have a dark skies ordinance, or Dark Skies Act, I think is what it's called, which is beautiful, and we love to see the stars, and that's one of the reasons why I moved here, just to be in wide open country. But I think we need to do better with constructing pedestrian facilities and lighting for those facilities in concentrations where people are walking. The Pueblo of Jemez lost a tribal member not that long ago, a few months ago, in the city of Rio Rancho, leaving the hospital, walking along a rural road with the speed limit of, I believe, 55 miles per hour. And he was walking on the shoulder in an unlit area and was struck by a vehicle. So yes, we have fatalities on reservations and in Indian country, and we also have fatalities in the urban areas and cities where Native Americans also live. So we just need to do better with the road designs. We need to mandate and incorporate pedestrian facilities be constructed for every roadway that's constructed.
Yeah. And I know in Albuquerque, not too far from Pueblo of Jemez, there is a large native population in part of that city, and it is one of the most dangerous areas to be a pedestrian. International Drive, I believe, is the name, or International Highway or something. The question was about the relative numbers of Native people who are killed while walking in urban suburban areas versus rural areas. I'm just not sure if we have that information. Hillary, do you have any further insights?
No.
Yeah. All right. Well, we are almost out of time, so I want to move to our final question, and I'm going to start with Maya and then go to Sherry and then Hillary. Maya, what one piece of advice do you have for tribal communities working to address the crisis of pedestrian fatalities?
So from my perspective, thinking about physical activity and about striving to improve conditions, not only for, thinking about cars and kind of classical perceptions of transportation, but also from a health and social connectedness, not only physical health, but mental health. Really considering how public health can be a dynamic within those transportation issues, and considering working together with tribal health departments, and ensuring that some of the questions that are being asked through community engaged work is reaching some of the folks who are disproportionately impacted by lack of pedestrian safety, such as people living with disabilities, older adults. We've seen examples of working with young people across some of these projects. So not only considering transportation officials and other potential leaders in the space, but also really asking a broad category of folks, as well as partnering with health departments.
Thank you. Sherry, your piece of advice.
Right now it is data collection. That is my biggest piece of advice. What we are doing is we have borrowed tube counters from the NMDOT. They graciously lent those to us to count bicycles. We borrowed our speed radar gun from the police department here at Jemez to document speeds on some of the side roads in the Pueblo. Collecting data is paramount to getting funding to design and build your improvements. And so that is one thing that tribes are really lacking is funding, and they need it. And if you have questions about that, feel free to contact me and I can help you discover ways that you can collect data.
Great, thanks, Sherry. Hillary?
No, I agree with Sherry. It's definitely data driven. And one thing that I'm finding out is making sure that you're tracking your progress, because progress, although sometimes slow, it is happening, and to make sure that you're documenting your processes and the procedures, because that's something else that's going to be needed when you are going for that funding, is how did you get there? Where did you start, and how are you there to get where you are now?
Right, thank you. All right, I want to thank all three of you for all of your work and your participation in this webinar. Send our best wishes to Hollyanna Littlebull, who could not be here, unfortunately. I'm going to share my screen for just the final slides here. And I do want to, again, let you all know that America Walks is accepting donations to support webinars and other programming. Here's a QR code that you can use to support that work. And finally, just announce our next webinar, which will be on September the 4th, 11 a.m. Pacific time, 2 p.m. Eastern time. And we'll be connected with our Week Without Driving campaign. And the webinar title is When Driving is Not an Option. So with that, thank you all for attending, and wish you a good day.